I've got a panel with me today talking about one of those things that if you ever were like me, wearing braces, you would think back then, why couldn't this technology be with me today? Remember when we were wearing barbed wire fences in our mouth and it was painful and we were cutting up the side of our fence, of our mouth? Where were you, Ken Fischer? Ken's with ClearCorrect, and it's the perfect transparent removable brace, something I wish had been invented. It's not about me, it's about you guys, so let's get talking. But tell me about ClearCorrect first, and then we've got two guys who are big fans.
David, I embraced clear aligner therapy in 2000, a long time ago. So I've used these invisible removable braces for a long time. I've been using ClearCorrect exclusively for the last 3 years. So there's been a number of enhancements, improvements throughout the journey that we've all taken with clear aligners.
Perfect. Now, Meena, I know, for instance, that how are digital impressions affecting cases?
Well, you know, newsflash, patients don't like impressions. So when we can do it digitally with a camera in less than 10 minutes, it improves the case acceptance dramatically. So when you can offer that to a patient and say, we'll take a digital video of your teeth and create a model, it's hard for them to say no.
And Peter, what's the best kind of a solution is this for patients? I asked you earlier, is this a good solution?
It's the perfect solution for a general dentist to bring this therapy to their patients. You know, Meena's talking about taking impressions. It's not easy to do a full arch impression. When we're utilizing ClearCorrect Ortho to do our scan, we get that instant quality control. So we get a better product from a great company that allows us to take care of our patients in a better way.
Let's talk about 3D guided surgery, for instance. How has that affected?
It's changed the way I do implant dentistry.
Yeah.
It's revolutionized. I'm able to know before I touch my patient exactly what's going to be needed. It allows you to be a visionary instead of being a reactionary. You know, the last thing you want to do, and I know Meena does a lot of implant surgery also, you don't want to get in the midst, open things up, and then all of a sudden, oh, Mrs. Jones, we needed to do an additional procedure. They want to know before the fact.
Right.
You know, they want to know what their financial commitment's going to be, what their time commitment's going to be. And same thing when we're doing our ortho. It makes things so predictable and so easy.
Right. Yeah, and it's the same thing with when you're taking a digital impression, I can see it instantly. So I know, just like Pete said, that I have a good impression and I have good data. And now ClearCorrect can actually receive that data and give me better fitting aligners instead of waiting for an impression that may not have everything they need.
And Ken, I know we're talking about ClearCorrect. Let's go back one step now that we know that Dentsply and Sirona have merged. How has that merger helped your business?
Well, let me back up just a minute. One of the neatest things about creating an orthodontic smile is the smile that we see on the patient's face. I can share with you that the next best thing is seeing the smile on the patient's face when we tell them we don't have to put that goopy stuff in their mouth anymore. You know, we tell them we do these digital scans now to create the impressions of their teeth, and they light up, let's go, let's do this, you know, because they know the difference. It's revolutionized the way we practice. And not only has it made it more comfortable and easier for our patients, but it's enhanced our operating time in the chair, the doctor's time. It enhances the speed of us being able to perform or deliver the braces to the patients. So it's just a blessing to enter the world of digital dentistry.
Yeah.
Nice. It's all about digital, isn't it?
Yes, it is.
You know, we're small business people. Doing it digitally, we're removing the need to do impressions. You know, impressions are not free.
Right.
They're expensive. They take time. Doing it digitally just streamlines the whole process, makes it easier, more profitable, and better for me as a small business owner.
And I would think the margin of error, right? There is none, is there?
That instant quality control, and I know Meena's going to back me up on that.
Absolutely.
You see exactly everything. You don't get that phone call 2 weeks.
Right.
You know what? Your impression isn't up to par. Can you retake it? That's not a practice builder. That's not a confidence booster for your patient. When, oh, you have to come in because I stink at impressions.
But you don't, do you? No, I'm kidding. What were you going to say?
Well, you know, especially in this day and age, people are they want instant gratification.
Right.
And if I can take a video of their teeth in less than 10 minutes and show them what their teeth look like and have a treatment set up within a day, they're getting their feedback right away. And that's what they expect this day and age.
It's that phrase, dental in a day, that I keep hearing over and over again. Once that became commonplace, it's a game changer for everybody. I, as the average Joe on the street, going, oh my goodness, I've got to do 1 and 2 and 3 and 4 trips. Now I can do everything in one day.
You know, for people to come to your office, it's not that hour appointment that they're in their chair or whatever the time we allocate for. They have to take off from work. A lot of companies don't allow them just to take a half day. They have to take a full day off. So when you start doing this treatment and it's visit after visit after visit, you know, it doesn't matter who it is, a soccer mom or an executive or whatever. Time is the one thing you never get back. So if we're able to save them time and make it more convenient, it brings down that roadblock and they accept the treatment and go forward with it.
Right.
David, at ClearCorrect, we found that 80% of the rejected PVS impressions that are submitted to us are due to some imperfection. And we've almost totally eliminated that rejection rate by accepting digital scans. We prefer digital scans because of the accuracy that they provide us.
Do you guys ask yourself, and this is a common question that we have heard a couple of times today, are you finding yourself going, what's next? How can they top this?
Exciting time.
Yeah.
That's why these meetings are so great. We find out what's new. You know, Dentsply Sirona is a great company. They're investing a lot of money to make our lives better, allow us to do better treatment to our patients. So the sky's the limit, really. You know, I know Meena, I've been out longer than you, but I don't practice dentistry any way that I did before, 5 years ago, 6 years ago.
Yeah, and we were talking, actually, a lot of my classmates aren't even up to speed on this, and we just graduated, 7, 8 years ago. So it's still evolving, and I'm just happy to have a front seat and watch this thing go. And
going full circle, the name of CIROWORLD, the byline is the ultimate dental meeting, and now with this merger of Dentsply and Sirona, it's the ultimate dental company. So as Dr. Klim said in one of our earlier meetings, he said, there's no better, more exciting time to be a dentist than right now.
It's really true.
Yeah.
Yeah.
Any closing comments before we head on out to the next show?
No, just...
Any big plugs?
Well, I would just like to encourage patients and other doctors that see this or are watching us today to understand just what a positive this new digital dentistry has made on our whole profession.
Yeah.
And hopefully share that with the patients. We'd all like to extend the message to the patients that dentistry has changed. It's not the same old stuff that they used to be afraid of in the past. The future holds a lot more positive restorations, smiles, teeth straightening. Come and get it.
Yeah, come and get it.
Yeah.
That should be a marketing campaign. Today's dentistry. Come and get it.
Yeah.
Thank you, guys. I know we've got a lot more to go out and enjoy tonight and for the rest of the weekend, and we're just really getting started. But I appreciate you taking the time to be with us.
Thanks, David.
All right.
For having us.
We're going to take a break. We'll be back with more CIROWORLD 2016 right after this.